Hello guys, welcome back to my channel. So guys, the name of my channel is Study Talks Nursing. On this channel I talk about nursing, health tips, finance and little bit of vlogs. So guys, if you want to get more information about what I'm going to be teaching out on this channel, then subscribe to my channel and click on the notification bell to let you get information each time I post any new video. So I just concluded an elaborate series on high blood sugar, which is diabetes, recently. So guys, if you have not watched that video on what high blood sugar is all about, please go check this video. You'll get them in my previous video. So now I'm going to be going to another interesting topic, which is high blood pressure. This topic is also going to be a bomb, so you don't want to miss it. If you want to get in-depth information about this topic, which is very important, then please subscribe to my channel and don't forget to click the notification bell to let you get information each time I post a new video. Now let's get started. So what is high blood pressure? High blood pressure is the pressure of the blood on the arterial walls. High blood pressure affects 1 in 3 individuals. A blood pressure that is well controlled reduces the risk of death by 25%, and the blood pressure that is well controlled also reduces the risk of stroke by 35%. Now, before we go in detail what high blood pressure is all about, let's first talk about the heart, which is a major contributor or factor that actually affects high blood pressure. The heart is made up of 4 chambers, the left and right atrium, and then the left and right ventricles. The atrium takes blood from the body directly and supplies to the ventricle, where it goes directly to the lungs for oxygenation and nutrition. And then from the lungs it goes straight into the left ventricle, from where it enters the arteries, which supplies the body directly. So it is safe to say that the arteries supplies blood away from the heart, while the veins supplies blood towards the heart. Now let's get into high blood pressure. So your blood pressure is said to be normal when it stays within the range of 110/60 to 120/80 persistently, and then it is said to be abnormal, or it's said to be high when it is persistently above 140/90 millimeter of mercury. Now, what am I trying to say? If your blood pressure is around 110/60, 120/80, 130/80, and not more than 140/80, it is said to be normal. But when it now becomes more than 140/90 and above, it is said to be abnormal, which in other words is known as high blood pressure. But you can only confirm this when you persistently or consistently check 3 times at least to be able to diagnose that this person actually is hypertensive or have high blood pressure. Now, there are some factors that you should consider when taking or checking the individual's blood pressure, because these factors, if not put into consideration, can actually affect the individual's blood pressure, either becoming low or high. Now, number 1, when the person is not well seated or the foot is dangling. Number 2, when the person has just smoked. Number 3, when the person has just taken alcohol. And number 4, when the person is talking while you are checking the blood pressure. And number 5, when you are checking the blood pressure on a clothing. When you are not using the right cuff or sphygmomanometer, it affects the blood pressure. Also, when the individual has a full bladder, or when the individual has cold. All these goes a long way to affect individuals' blood pressure. This therefore has to be put into consideration and be corrected before the individual check his or her blood factors affecting blood pressure are cardiac output, the blood volume, and then arterial wall resistance. Now, cardiac output. Cardiac output is known as the amount of blood that the heart pumps out of the heart per each minute. So if this amount is much, it affects the blood pressure. It can in turn increase the individual's blood pressure. Number 2, which is the blood volume. The amount of the individual's blood in the entire body may actually be too much for the body. So if the amount of blood is too much, it in turn affects the individual's blood pressure. And number 3, the arterial wall resistance. This arterial wall resistance is divided into 3 factors: heart flexibility, vessel flexibility, and then the blood viscosity, and then the diameter of the heart. Now, the flexibility of the vessels. Yes, a healthy vessel or healthy artery actually expands to accommodate the blood flow through the heart. So when the vessels are not able to expand with each blood flow, it affects the blood pressure. And also the blood viscosity. The blood viscosity is the thickness of the heart, and this can be affected by the protein and fats and other things in the blood vessel. So when the blood viscosity is high, or the thickness of the blood is high, it means that the heart has to overwork itself to push the blood through the vessel. So this in turn actually affects the blood pressure, which raises the blood pressure. And also the diameter of the heart. Now let's go back to the causes of hypertension. The causes are essential or primary and non-essential or secondary. The primary cause is actually unknown. There's no direct or traceable cause of primary hypertension, but the causes is actually linked to certain risk factors that we engage in our lives that directly or indirectly result in hypertension. So these risk factors, I'm going to group it into a single acronym to be easier for my nursing students to remember. So this acronym is risk factors itself, where R stands for race. It is known that Black Americans usually have more increase in high blood pressure than any other race in the world. I stands for increased sodium in your diet. S stands for smoking. K stands for potassium reduction, and then F stands for familiar tendency. A stands for advancing age. C stands for cholesterol increase. T stands for too much caffeine in your diet. O stands for obesity, and then R stands for restricting activity, and then S stands for sleep apnea. So these are the direct causes or indirect causes of primary hypertension. Now, the secondary hypertension has its root cause to several diseases that we may have in our lifetime that results in high blood pressure or hypertension. Now, some of these diseases are pheochromocytoma, which is cancer of the adrenal gland, hyperthyroidism, which is diabetes, renal failure, Cushing syndrome, and even pregnancy actually induce hypertension in our system. So, what do we do to prevent hypertension? Engage in passive or active exercise. Avoid being obese. If you are obese, try to engage in exercise. Avoid sedentary lifestyle. Eat right by taking a lot of fruits and vegetables in your diet, and then also reduce the amount of sodium or salt in your diet. Do not add extra salt to your diet when you are eating, even when you feel it's not enough. And then avoid taking alcohol, excessive intake of alcohol. Avoid smoking as well. All these go a long way to affect your blood pressure. The blood vessels reduces or increases its diameter to increase or reduce the blood pressure respectively. Also avoid smoking, as this goes a long way to reduce your blood pressure and reduce your risk of having high blood pressure. So guys, this is the end of this video. So if you enjoyed this video, please give it a thumbs up, like this video, drop a comment and then share